Welcome back to the Yoga Well podcast. I'm your host, Chase Bossart, Executive Director of the Yoga Well Institute and a longtime personal student of Mr. TKV Deshagachar. Today, it is my great pleasure to have Tina Wang in here. She's an MD of Physical Medicine and Rehabilitation and an assistant professor at Loma Linda, the UC Riverside, and the Southern California University of Health Sciences. You do all kinds of interesting work, and you have been really doing a deep dive in Vini Yoga for quite a number of years now. So welcome on the podcast.
Thank you for having me. I'm extremely excited to be here.
I'm interested in hearing a little bit about your yoga journey. Like, how did you find yoga? How did you find Vini Yoga, etc.?
Yeah, I think I stumbled upon Vini Yoga and yoga very similarly, in a similar fashion to most Americans, most Westerners. My first exposures were when I was pretty young as a dancer. And dancers were weirdos, were into all sorts of weird things. And these were the days before there were big yoga studios. So it was kind of underground and you had to know where the teachers were. And of course, it was still American type of yoga, not Vini yoga. So there were cultural differences that we can dive into. But over time, I really would return back into yoga periodically because it gave me movement patterns that were really different from your typical ballet type movement patterns. I always liked how I felt at the end. And so as times got tougher and life got tougher, I'd always find myself making my way back into yoga, not really understanding why I felt a certain type of calm or peace at the end of whatever practice I was in, whatever type of yoga. I was chase that feeling, no pun intended, Chase. I would chase that feeling. And so I decided, I don't know what this is. I'll figure it out. And I'll figure it out the way I figure out everything, which would be a deep dive and study and keep searching. And so I started to find as many resources as I could about yoga and the philosophy of yoga. And I started listening to podcasts. And I knew I wanted to start studying more deeply with a teacher, but I certainly did not want to just take a studio teacher training. That's so silly. I'm not going to take anatomy from a yoga teacher. And I don't mean that in a pejorative manner.
Totally. Yeah.
I just, we're dissecting cadavers and we're cutting into bodies and I'm retracting human beings and I'm looking through laparoscopic lenses at the human body. And it's a little bit different to then go into a 200-hour and have someone lecture to you about the human body from a textbook. So I started listening to a lot of podcasts, and you ended up on one, and you were so contrarian in your Chase way. Contrarian in that you just shook up the point of view of your hosts, and you would invite them to explore other ways of seeing the world, of seeing their practice, of seeing the approaches. And I just started to follow you as much as possible, which in those days was very difficult. You did not produce a lot of social media content and public content. And I've watched you grow and change over the years as well. It's a lot of the same things that all of us in Vini Yoga struggle with. And we can get deeper into that.
Yeah.
And so
Yeah.
after I found you, I called you. And do you remember that phone call? It was such a world shaking phone call for me. I called you and I said, okay, I want to study with you, but I can't spend all this time. So you're gonna help me, and you're gonna do it this way. And you said, no, we're not doing any of that, and you're gonna do it my way. I've been doing this a long time, and that's the way. And you let me know after you start practicing this, after you spend time as a practitioner, after you understand what this science of experience really is, then you can come back and then we'll talk about teacher training, in-depth training, all of this other stuff, that you might be interested in, but you're not ready for. I said, okay, sure, you're the expert, fine. And that's how I got started into Vini Yoga.
So, I have to say that one of the things I really appreciate about you is your willingness to take guidance. So many people are like, okay, and that's the last time I ever spoke to him.
Yeah, I can appreciate that. I think there's a couple things there. I think one is that I'm neurodivergent. So people, when I'm trying really hard to be polite and indirect and hint, people describe me as, she's very direct and nice. When I'm myself, people say, oh my goodness, she is so rude. So I think there's, one part of this where it's perspective, where a lot of people can see guidance as being rude or pushing boundaries, and I don't. My perception is this is a person, this is a human being who is at the top of his field. He knows what he's doing. He's seen a lot of students. He's seen a lot of clients. He knows what he's talking about, and that's part of learning. The second part is my role as a physician. People, and this is where yoga has helped me so much. People don't actually, well, it's not don't actually, it's they may not be ready to hear what I have to say. And so when I seek expert guidance myself in something that I know nothing about, I'm ready to take criticism. I'm ready to take direction, because when I'm on the other side, it's incredibly frustrating.
Right. Yeah. I want to hear a little bit more about this, but first let me just backtrack a second and say that one of the most stunning moments in any teacher training that I have ever done, which is, 25 years or so, was we at many of the trainings we have these periods of time where we invite people to introduce themselves. They go around the room, or they go around now Zoom. Everybody, we were doing several every time we met, just so that it wouldn't overwhelm. And you opened by saying, "I'm autistic," and it was just a matter of fact. And it's like I have a broken leg. I couldn't do this or do that. And you went on to say that yoga has had a huge impact on your life. And it was like one of those moments where everybody in the whole training has chills, and it just takes the quality of the training to a different level, because now everybody can see like, oh, this is a safe space, that I'm going to be understood, and this is some place where I can actually get my questions answered and my needs met. And I remember it just being like, oh, everybody fasten your seatbelts. Here comes the training. And yeah, can you just talk a little bit about that introduction?
Yeah. I'm thinking back because yoga has helped me heal so much. So I have to go back and think that that training program was so transformative, so transformative. And I didn't expect that. I did not expect that. I showed up to work. At the time, I was asked to be a part of the clinical trial running in my hospital as the yoga instructor. And despite years of being a practitioner, and when you're a practitioner under this lineage, I would venture to say this many years out, looking back, you become quite qualified to teach as a teacher. However, humility is a tool. It's a good tool, and I did not feel that I was sufficiently trained or qualified to take on such an important position within the clinical study without additional training. And so I signed up for this program, really excited to jump in much deeper into yoga after all these years of studying and ready to work.
That was the title of the training. It was the Deepen Your Yoga program, I think. Yeah.
Right. And
we really see it as like a practitioner training. It's like, we're going to explain, like, here's what is yoga, and here's how to think about, like, what is a practice and how do you organize it. And here's for the practice of the body, and here's practice for the breath, and here's practice for mind. And then, oh, by the way, here's the textual context and foundations for this so that we can understand how this applies to my life. And why is 1 hour, or why is it called practice when I'm on my mat? Because, practice implies that we're, practicing something. So here's how it applies to the real world. And it's really, the idea is exactly what you're saying, is to give people the full context of what is yoga, so that have some confidence in what the hell we're doing here.
Right. Yeah. And if you haven't been to Chase's courses, he has practitioners, instructors, teachers of all levels and all experience. And I gather some quite famous people as well, although I don't follow that scene, so I would not be able to tell you. But based on my classmates' responses, so and so is in this class, or you study with so and so. I don't know what that means, but from those type of comments, I imagine that there are some big wigs. And so I show up to this class, and I've been doing enough yoga to realize how uncomfortable I am. And I hate introducing myself, and I hate group settings, and I hate telling people I'm a physician. There's all sorts of responses that come out of that, both positive, both negative, reference that's not deserved, anger, none of it is deserved, but I see all these reactions. And then myself with the ego of like, I'm so uncomfortable. I don't deserve to be here. I'm an imposter. So then I should tell everybody I'm a medical doctor and just shut them all up, because no one's going to have a higher degree than this, right? And it's just all these things. And my palms are sweating, and I'm watching these thoughts roll through my head, and like, well, what is the most authentic self? It's like when the Dalai Lama showed up and started describing all his emotions. no words to say because he was so nervous. And that's how I felt. And at that moment, the one word that could come to my mind is autism. I'm pretty sure other people may feel something like this, but not to this degree. Because every time I show up, I don't know how people react to me. It's so unpredictable. I can say something like, I don't want to take anatomy from a yoga instructor, and I will get an explosive response, or I'll get an understanding response. I can say I'm a medical doctor and I will get all sorts of responses. And so the only thing authentic was to say, I'm showing up here. I am neurodivergent. I don't know how you're going to respond to me. I am uncomfortable. All I know is that yoga has helped me so much that I could feel what I feel right now and not run away, not be angry about it, and own it with all the discomfort that comes with it.
Yeah, that was the second part of what you shared. You said, yoga has transformed my life because I now have a way of coping with the emotions that I feel. And for a large part of my life, I have been the recipient of people's anger. And you were like, and I never understood why. And now here I am. After I have this practice come through, it has completely transformed how I relate to people.
Yeah.
I mean, this introduction was years ago. It was a long time ago. But I remember it like so clearly. I was like, ding! Okay, here we go. Love it. So good. Can you say a little bit more about that, though? The anger and the.
I think from a very, very young age, it was before the time of diagnoses of people like me.
Mm-hmm.
And my poor mother, this immigrant woman who's very neurotypical, just really struggled trying to raise me. And that poor woman. And she tried to do her best, which from my perspective was very abusive. And now with yoga, I can look back and say, Mom, I love you. I know you tried your best. You're gonna bring me to tears because I just despised her for years. There was so much hatred. Sensory processing issues where I could not, I needed compressive feedback. So I had to wear pants, but she wouldn't let me wear pants because that would somehow make me turn into a lesbian. And I was such a weirdo. And this girl has to be married off one day and she won't wear a skirt. It's just this poor immigrant woman from a traditional background and all the thoughts that went through her head. And so from an inability to make friends, not understanding how all these people made friends, trying to mimic them. And I mean, I remember from a really young age trying to mimic behavior, and it would just freak the kids out. And then they would gang up on me, all sorts of stuff. And then I'm also a child of immigrants, so I come to school with weird food, weird smelly food. And so from a really young age, there was just so much anger. And if I didn't have the anger, I would implode from grief and loneliness. And that anger really fueled the drive to survive. I wouldn't even say to succeed. It was a drive to survive. And then at some point, that anger just starts to consume you. I don't like women because they are hard to understand, and for some reason they just hate me. I show up and they just hate me. I can't understand why. What's going on? I sit down, I say hi, and I don't understand. And then yoga also helped me after all these years of understanding and reflecting that perhaps I need to go get a diagnosis. Like, this is interesting. And so as our understanding of autism and neurodivergent conditions started to evolve, then more resources became available, and I went and got additional training, because that's what I do. Is when I want to understand, I gain more training. So I joined the UCLA leadership program in neurodevelopmental disorders, and through there I was able to study with some of the leading experts in the field, obtain a diagnosis, understand more, and I would say yoga prompted all that, because there has to be self-reflection. There can't just be, well, women just don't like me, too bad. It's like, well, what is going on here? No one likes you. And that's actually a really painful thing to admit to yourself. For years, it was hard to say, I don't have friends. I can't make friends. I am incapable of making friends, despite trying. Super painful to say, yeah, there's something not wrong with me, but there's something here. And so part of the diagnosis, and Amanda Green's my mentor, she went through every step of the way with this with me. The explosive anger that started coming out years, even though the anger fueled me, now is being released. And so how dare the world see me differently just because I'm neurodivergent? This is a rule not made for neurodivergent people, blah, 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 blah. And then you do the yoga, you do the digestion, you do the crying. And then one day I say to Amanda, I haven't even thought about being neurodivergent or autistic. I just am. I'm not angry anymore. I don't worry when I walk into the new program I've joined with you. I don't walk in and think, oh my goodness, how are people going to think about me? Blah, 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 blah. Just, I show up, and whatever reaction that's there, I just let clarity and an inner knowing kind of guide that. Oh, I said the wrong thing right there. That's still a Chase problem, not a Tina problem. The next time, I don't own that. Next time, I will try not to say something like that, because I can see that didn't land well, but it's still a Chase problem, not a Tina problem.
Yeah. It's so good. It's so good. We had that really, I would say, in-depth, surprisingly deep conversation. And then I connected you with Amanda, and then I didn't hear from you for a long time. But, I occasionally get reports from some of the teachers that I connect to. Amanda was like, Tina is killing it. Killing it. You'll see her. It's really a testament to the powers of yoga that it can create the journey you just described.
Yeah. I think one of the most helpful ways, I remember this conversation with Amanda like it was yesterday, and I imagine it's been a few years, but it just seems so clear. She said, or my interpretation of what she said is, puruṣa is pure. Whoever I am is pure. And it is the manifestation into materiality that then becomes something else that is perceived or digested by others in whatever manner. But puruṣa is pure. And so I don't get to go around saying there's something wrong with me and other people need to accept that. It's more of an exploration of how does something so pure manifest in materiality, and what are the struggles that we have with that manifestation.
Yeah. So nicely said. So nicely said. I think that it is really a wonderful starting point that we're all quote good. We're all, positive. And then it comes through our container. And so if some errors are happening, well, that's also can be worked on, can be revised. It's really such a potent way to think about one's life. So, what do you do with the yoga now? I know that you are seeing clients and you have quite a challenging, and I would consider interesting, but quite a challenging position where people are coming to you and you're deciding what their next steps are, etc. That's
Yeah.
one of the roles you play. Can you say a little bit more about that?
Yeah. So my specialty is physical medicine and rehabilitation. And I'm also a clinical researcher. My expertise is in connective tissue or fascial based disorders, in particular, hypermobility disorders. So that's kind of my wheelhouse, is the systemic manifestations and comorbidities that occur in hypermobility disorders. And it is non-curable. And I work with patients who have very difficult, chronic, debilitating struggles in life. And we put together comprehensive plans and interventions on how to holistically manage rather than treat all of the systemic issues that occur. I also work with veterans with complex health needs. Wow, are the comorbidities quite intense. And so these are my multiple roles. And where yoga comes in is really managing of me, the practitioner. Of course, I use it with patients in the way Mr. Desikachar describes, is figure out how it shows up in each of these people's lives. So it's not going to be asanas or pranayamas. What is it? It might be a meditation. It might be a thought. It might be a movement towards away from a tendency with a new pattern. So yes, of course, I use it that way, but I would say the most fundamental, overarching, life-changing way I use the yoga is in the management of my own system. It is completely overwhelming, heartbreaking, and I wouldn't say sucking, it's soul destroying to work with people with chronic illness. Because a lot of times it's not even watching them get better. It might just be slowing down the decline. And you can imagine all of the residue that comes out of that person towards you as a physician in those states. And so yoga allows me to manage my own state and to be able to show up in a way that my patients need me to show up.
One of the things you shared in the class was you said, today I had a meeting with a person and he yelled at me for an hour and a half straight. And at the very end, he said, thank you.
Yeah, I remember that. That was really quite an experience. So I also study biodynamics of osteopathy, and there are so many. It's an osteopathic technique approach, and as well as practitioner state. So practitioner state needs to be in neutrality, and it shares so much with Vini Yoga on how to arrive and be present. And so the two practices feed into each other. And what yoga has taught me. So I'm going to give everybody a primer on how a physician is supposed to think and how we're trained to think. So we use a lot of Bayesian statistics when you walk in with your knee pain, your neck pain. We go through a differential diagnosis and we'll assign probabilities based on population risk, your age, your gender, your sex, type of work you do, and we'll assign different probabilities. And based on those probabilities, we'll do examination or diagnostic workup that has an odds ratio of a sensitivity, a specificity, and a positive predictive value, a negative predictive value. And then we'll do some calculations in our head and we'll say knee arthritis. But we didn't just look at you and say it's knee arthritis. We went through a lot of calculations in our head based on all the history that you've given and looking at your chart. And then you might say, okay, it's time for some physical therapy or injections or let's go straight to surgery because yada, yada, yada. More statistics, lots of statistics. And what happens in there, we're so busy doing statistics in our brain and trying to figure out your diagnosis that then guides your treatment that patients do not feel heard. Right. And so you don't know what's happening in there. You just don't feel heard. That darn doctor spent 3 minutes with me. Meanwhile, their head is cranking away on statistics. You say knee arthritis and the guy is like, you didn't even listen to me. I said that I can't walk across the parking lot to get to pick up my kid. It's embarrassing. I'm limping along the way. And you told me to take some aspirin? Who are you? Right? And I'm just thinking, and for years it was like this, every room. And, I don't know if you missed that first part of the podcast where I said I'm neurodivergent. So you compound that with our medical training and my goodness, it's just explosive in those rooms. And I am so confused. And so for years, I am so confused. And the patients with complex illness love me because I'm sitting there doing all sorts of complex calculations and making diagnoses or workup plans that other physicians may not be able to digest and kind of utilize. But your typical bread and butter patient just absolutely hates me because they don't feel heard. And that's one of the first thing that yoga gave me was the ability to put away those patternings, that training, all of that is still there. It doesn't disappear because I say, okay, I am not showing up as Dr. Wang. I am not showing up as Tina. I'm showing up as whoever you need me to be. So I'm going to sit here. I'm going to regulate my state. And then in the osteopathic terms, I'm going to sit with the tide. I'm going to sit with neutrality. And we're just going to listen. And we're going to figure out what you need. Do you need a brace and some icy hot to put on there so you can walk across the parking lot and not hobble? So you can pick up your kid from preschool, then okay. But we're going to just sit here, we're going to listen. Or I'm scared to death. I have a lot of cancer in my family. Yes, I'm 30, but my knee hurts and I'm really scared. Well, then it might be an MRI and it may not be quote unquote medically indicated based on all my statistics, but I'm treating the human being in front of me who is scared to death that they might have cancer. And you just listen and you figure out what is it that this human being needs. And that's the gift that yoga has given me because I don't get yelled at anymore. Or in this case, this poor guy. So I'm sitting in the tide. I'm listening. I'm being president. I'm managing my own state because being yelled at is not fun. So I'm just thinking, well, nothing he's saying is like I did anything. He's not saying you are terrible. I hate you. It's just like, it's so frustrating. Nobody can figure this out. Nobody will do anything. I've been at this. And he's just going on and on and on and on. And I said, okay, all right, well, and he just stopped after a while. He stopped and I said, well, okay, I don't have much to offer you. but we can image this and see what's going on and figure out next steps. And he looked at me and he said, okay, I really don't know. And then he goes on his tirade again. And at some point he stops and he just says, thank you for listening to me. I mean, this is the extent of the interaction. And he says, all right, I'm sorry I wasted your time. And I, like Mr. Desikachar, I didn't do this because of Mr. Desikachar, but I just started naturally doing it. When I started practicing the yoga, I'd walk every patient out. And as I'm walking him out, he says, I changed my mind about that MRI. Can we order that? And then he starts profusely thanking him as the only doctor who has ever listened to him. Which I don't know if I was listening because I was trying to manage my own state. There's a lot of anxiety. Like, this is going on a long time. I need to get to the next patient. Okay, all right. But you can't just, this guy is really upset, so let's just stay present. Okay, he's just still going on and on. This is really agitating. And okay, that's okay. Let's just stay present. What is he saying? What is he trying to express?
I love it. At the end, I don't know what I want. And then finally, yeah, I'll take that imaging. Thank you.
And I still don't know what happened in there to this day. I was like, yeah. Okay.
Well, I want to return to a comment you made at the beginning, which is that you were in the dance world, and how the dance world didn't make you feel like this. That actually yoga makes you feel like somehow different than another pretty comprehensive physical activity. What I think is lost, or what is very often missing in Western yoga, is this context that there's been a couple thousand-year discussion, or going on by people who have been doing this practice and observing its impacts on them. And that when we look at yoga as a exercise or as a physical activity, or it's very intentionally impacting the person's relationship with everything else. And it's like, why can we call this practice? Because you do it in the morning, and then during that time you come to some understanding of how I am right now, and then you go into your day. And as you go into your day, you can see, oh, how am I doing now? And what's happening for me now? And the better you get at yoga, if there is such a thing as better, is the more aware you become of, what is my state? What am I thinking right now? Or what is my attention on? And how does that relate to what's going on in the situation of this moment as we come down the line, as we refine, as we do this more? There is a space that opens up where we get the capability of recognizing certain feelings. We get the ability to recognize one feeling set from all the others. And then when we have that feeling set and the content that's related to that feeling, like say this, or leave now, or invite them to this or that, or whatever the content of the mind is around that set, and we are able to follow that and actually do it, incredible, amazing things happen in our life. And it's such a interesting physical activity, although, of course, yoga is not only physical. And I'm just wondering about your experience in dance and whatnot. That does dance have that kind of impact on someone?
I think so. There's so many layers here. There's so many layers. Yoga is unique. Yoga is really unique. I've heard you talk about perhaps Tai Chi is a similar type avenue, and I can only speak about my experiences yoga and comparing that with dance, with exercise. And I've heard you say this many times before. So I think at the most basic, if we're going to compare and contrast, we'll talk about weightlifting, running. And for many years before yoga, that was the way I coped with my perfectionism, my need for control, my way of dealing with stress and negativity and anger. And it's not addictive. It's you become reliant on it, and then you need more and more of it, and then it doesn't fix your problems. So you need to do more running, more weightlifting, more this, more that. And I recall even telling my husband, I am not okay today because I have to go work out. And then at some point, you can't do enough of it to palliate whatever need it is you're trying to soothe. In dance, it is a little bit different in that there is expression of movement, expression through movement, expression of self through that movement. So less so in ballet and more so in your contemporary, more modern type dances. And so I even remember refusing in my younger years, my early years, to learn anything beyond ballet because I was going to bend this body into whatever form that I wanted to bend it into. And as I started to explore dance in this Asian body, explore dance as I'm studying yoga, I opened myself to new forms of movement and exploration. And so in dance, I could find a means of expression. But that means of expression is it can get close, but it's not like yoga. And part of it is all of the social nuances that surround dance. So watching your body, watching the weight, watching the form, the aesthetics of it. It can be like Vinny yoga in that, like this weekend, I had the privilege of, I'm in a dance company and I had the privilege of not being there physically. So I was the rehearsal assistant watching the movements and giving feedback. And one of the healthiest feedback that I gave, and one of the gifts that I feel like or insights from yoga, was really looking at them and saying, you know, you look best when you honor your physicality and your neurology. Instead of forcing your body into that pointed toe in your jeté, use a modern form. Bend at the knees, dorsiflex the foot, bend the arms. go into this contorted pattern that your body likes. Honor that rather than forcing yourself into perfection. And you could see everyone just relax. Everyone, all the dancers just relax into that realization that they didn't need to try harder. They just needed to try to honor who they were because they're good enough the way they are. Dance can give that when approached in a healthy manner, but the social nuances around dance itself and fitting in it into a form for performance, it's also performative, can really limit the purpose of with yoga, which is moving towards moksha, moving towards health. That's really not the purpose of dance, which is performative, which is an expression. And those are, because the goals are so different, the nuances are different. And you're not going to achieve through dance what you have with yoga. Not that they can't be complementary, not that they are not both amazing. It's just that the purpose are different and the nuances are different.
Very interesting. Yeah, as you're talking, there's a very strong component of self-observation in both of them. What is the research that you participate in with yoga or that interests you in yoga?
Yeah, yoga is super, super interesting. My research is in the facial characteristics of people with hypermobility disorders. Yoga in specific, the research really shows that it changes autonomic state. That's what's really powerful about yoga. So when we start to look at things like back pain, chronic pain, we're not quite measuring the right outcome. But the ones that start to look at the autonomic state really show there's a profound change.
So explain a little bit what autonomic state means.
Yeah, it's in yoga terms, it's rajas versus sattva. So you can get quite a bit more sattva or a change towards that state compared to that rajasic state that all of us run around in and that many of us live in because of chronic pain, chronic illness. Where I really love exploring is the use of yoga, Vini yoga in particular, concepts of DNS, dynamic neuromuscular stabilization, intra-abdominal pressure, and then some of the stimulation points from the Voita technique. So these are ways that we can turn the nervous system on or modulate it in a way that is healthy rather than turning it all off, tamasic, or allowing it to be too much, rajasic.
What is a research structure, or how do you prove that?
Yeah, that's so tough, right? So I have not quite figured that out, and so yoga and its approach and are super tough to study. So you can use EEG brain waves. You can use heart rate variability to measure that. And then, of course, your survey instruments. Those are ways to do it as well. And then my particular area of research is in fascial health. So how does that then change the fascial system? That I measure through ultrasound. The fascial changes itself. You can use MRI, but ultrasound is the most accessible way. And so you can measure in various parts of the body as well.
And I guess what would be the purpose of this? So Are you trying to show particular ways of moving, or you're trying to show a particular like what is it that you're showing?
Okay. Yeah. So in my previous research, I showed that in hypermobility disorders, the based on my colleagues' work and my co-researchers' work, Antonio Stecco, people with chronic pain have a thickened fascial layer. So they're thicker. And it's in the loose connective tissue, the glycosaminoglycan layer. So it's not the actual collagen, it's the gooey stuff. And so in hypermobility disorders, I showed that that's even thicker. And in subsequent studies, I showed that because it's thicker, the glide is impaired. Because the glide is impaired, then we might traction really hard on a joint. It might dislocate, it might sublux. And that impaired gliding, that thickened gunk in there, then irritates nerves, and we can have more pain. That then would also affect your autonomic state, so more shallow breathing. It affects feedback from the body because now you don't have proper force transmission and the brain's not understanding what's happening. So your gait's off, your breathing's off, your sleep's off. And the cells that are responsible for creation of this fascial tissue, the fibroblasts, they actually have immune function. So now you have immune changes. And they're very close to all of these autonomic nerves. So it's influencing the autonomic nervous system between the immune system, the fibroblasts, and the nervous system. And so you have this feedback within this fascial system. And so then we ask, okay, this is the state of hypermobility disorders in the fascial system. Then how do interventions start to affect this? So with injections, with loaded movement, with breathing technique, then you want to start to measure those outcomes. So you can do a it's not gliding so well, it's quite a bit thicker. HRV for autonomic nervous system is like this. And then you do a post after intervention. And that's all fine and dandy. That's not how yoga works. That's not how yoga works, and it doesn't do yoga justice.
This is one of the biggest questions for me in yoga research. And, I participated in quite a number of studies, both writing protocols and advising on them and whatnot. And, the yoga as a science of experience, the intervention is the experience. So if you standardize it and you say, we're going to move the arm 6 inches, well, 6-inch movement for one person is enormous and it's too much. And for another person, the 6-inch movement is nothing. Nothing happened. There's no experience. So we can't really say, if we're measuring yoga, we can't really say, well, we had them do this posture or that posture, because you don't know what the person's experience is. And I think this is one of the really difficulties in yoga research, is coming up with a methodology that honors the intentions and the experience that is being designed, instead of honoring, well, this is research. They have to do Dvibhadapitam, they have to do bridge pose, and they have to do it, and they have to achieve such and such a form, and then that the variety of the experience for all those people just invalidates it. Whereas if you allow all of this flexibility in what they're doing, and then you might actually get pretty close to, each person has the experience that you want. I think that this is really, really critically important when we're talking about designing research for yoga, because you wouldn't just have, like, we're testing a particular substance, you wouldn't just have, well, we don't know what substance was given to who or how many different substances, etc. Because you know exactly, precisely, etc. But you can't do that in yoga.
Yeah. I think, really studied design is really important. So the current study that I'm involved with is pragmatic study. So we put people through and we allow for clinical variability. Then we look at the outcome measures so that we're not controlling for 2 tadasanas and 4 uttanasanas, and you need to bend over 90 degrees and come up, and variation techniques. And so the study design is super important. And what is really tough is then you need the clinical researcher to actually really understand yoga or really understand low back pain or anxiety. And they need to understand all of these components to be able to design a study that meets real world applications and the patients and the clients. What is it that we're really treating, and what are the outcomes that are actually practically important? And that's not the gold standard. It's the randomized controlled trial where you bend over 30 degrees and you have a tape measure. And while you're bending over 30 degrees to the tape measure, you're no longer doing yoga. And so your outcomes are complete crap. That is the problem when we try to reduce and make real world experience 2,000-year-old traditions. When we try to shove them into a box, and this box is not just a box, it's a box with very specific size. And if you don't meet it, you're not good enough and you don't have a difference. You don't make a difference. So we're not paying for it. Insurance won't pay for it. And it's not a valid intervention for XYZ. And it's so reductionist. And it is not the best way to capture health outcomes. It's great for a drug. It's not great for a lot of our chronic illnesses that are multifactorial and require a holistic, and I don't just mean that in the Western holistic, looking at diet, nutrition, social. I mean holistic in the Ayurveda yoga sense of what is your spiritual health. And that does not have an outcome measure. I don't have an outcome measure for being able to come into a group yoga class and not have severe anxiety. I don't have an outcome measure for patients sitting across from me feeling really heard and walking out feeling like they really connected with someone. There's no outcome measure for that. And you can try to say you can make up this metrics, that metrics, this survey. There's no measure for that. And it's really reductionist to try to fit that, what we just talked about, into a randomized control study.
Hallelujah. One of the frustrations for me is, this double blind thing. And it's like, well, actually, the relationship is a tool. In fact, it might be the tool. And you're going to not allow that? Yoga is linking. Yoga is connection. Yoga is bringing together. So how do we do yoga if those are going to be the parameters about how we determine if something's working or not?
Yeah, the relationship is key.
So how are you navigating this with the construction of the research?
So it's a pragmatic study, and I get to show up. Like I've told you before in class, I just do yoga. And I leave all of those problems we just talked about to the study administrators. It's their problem.
That's wonderfully solved. I'm so glad we have this solution. It's very interesting. I've done a lot of work at the Vanderbilt University Medical Center, their Center for Integrative Medicine. And in fact, I specifically did a number of trainings, like 4 or 5 in Nashville, to create a community of teachers that would be able to implement the yoga protocols that we were designing for these various studies that a couple of people, yoga researchers, Dr. Gurjeet Beardy is one of the main ones in Nashville, so that they would have yoga teachers that they could rely on, that we could give them a protocol and say, this is what we want to take people through, but the point of this is we're wanting to influence the apana, and so we want to make sure that the person, the exhale technique looks like this and this and this, and you're going to have to change it based on what you see the person doing, and you have the understanding and the knowledge to do that. And so in this research, please do that. I think that there's a real sea change that's required in understanding or in thinking about yoga research, because just like you're saying, I don't think it's going to work for us really to accept the parameters of this other scientific world and to just take that on and to accept it as the basis, as the facts, and that this is what we're going to work in, because it's blind to a bunch of the most important pieces for us: connection, presence, attention, state is so important. And we sacrifice actually the things that are most important to our science when we take that on. This is, for me, one of the main issues I have with the things that are going on right now with IAYT, the International Association of Yoga Therapists, is that the focus, they're working hard to get yoga integrated into the Western medical facilities. But in doing so, they're almost dropping the yoga, and they're just taking the pieces that can be understood by those Western medical facilities and putting those forward. And in doing so, it's like, cutting out the heart and removing the liver. And, oh, by the way, we don't need a colon here, but you got a skeleton and you got legs, and, there's hair on the top of this thing. Must be a person, it's like, no, we're disemboweling ourselves. And in doing so, we're completely weakening and cheapening who we are and what we're doing. And I think that this is the mistake of the IYT. It has to be yoga first, and where can we be integrated as a whole, as what is yoga, into the facilities. That has to be the work that's being done, and not the other way around.
Yeah, I remember, I don't know if you remember the lecture you gave at Loyola Marymount. You had invited me to watch your lecture. Oh, and you made one comment, you got everyone so riled up, and it was fabulous. You said, if you want to be a physical therapist, go to physical therapy school. Otherwise, we're doing yoga. People were so riled up, and I loved it. I loved it. Because why would you be a yoga teacher, yoga practitioner trying to do physical therapy? And just go do physical therapy. And If you want to be a medical doctor, then go to medical school.
Yeah.
You lose, and going back to our prior conversation, if I want to sit at the cool kids table, then I'm no longer me. So do I want to redefine what it is that I want to be and who I am in my own terms, or do I want to be what someone else wants me to be? Which is always, I will tell you from my personal experience, never worked out for me. Trying to be a cool kid never worked out for me. I was even weirder. It's the weird person trying to fit in. And it's the same thing here. You want to make so many compromises about who you are and what yoga is. You will no longer be yoga. You will be allopathic Western medicine, attempted physiotherapy, medical doctor, Ayurveda, nurse hybrid, and you're no longer doing yoga. And if you're going to do that, you might as well go to medical school or nursing school or physiotherapy school.
Tina, so good to have you on today. Thank you so much. It's my great pleasure to interact with you over these years. And thanks for sharing your thoughts and insights.
Absolutely.
I hope we'll do this again.
Thank you for having me.
Before we go, where can people find you?
Easiest way is my website, tupelopointe.com, tupelopointe.com. And you can find out more about the research that I do and my clinical practice there.
Fantastic. We'll see you again.
All right. Thank you, Chase.